questions answered. Most experts agree one way out of the pandemic is with a needle, but news about coronavirus vaccines changes by the hour. A new shot from Johnson & Johnson could be approved by the weekend and in arms as early as next week. But the variants remain a concern. Moderna says it has taken steps to battle the new South African variant with a modified booster shot now being tested. Between Moderna and Pfizer, the U.S. has been able to distribute more than 90 million vaccine doses coast to coast. As of Thursday, nearly 70 million shots have made it into people's arms, with more than 46 million people receiving at least one dose and almost 22 million Americans receiving both doses. That is almost 7% of the total U.S. population. But as more vaccines become available, millions of Americans remain confused. What vaccine should they take? Is there a difference? When and how do they get it? Who should go first? When will things go back to normal? These just some of the many questions you are asking. This hour, we will try to give you answers. We've assembled a full team of professionals, including the foremost infectious disease expert in the country, Dr. Anthony Fauci, to give you the information you need about COVID-19 vaccines. We want to begin with distribution. My first guest is Bob Fenton, the acting administrator of FEMA. Mr. Fenton, welcome. It's great to have you with us. So, U.S. rollout of the vaccine has been, as you know, frustratingly uneven. We've seen other countries, such as Israel, vaccinate their populations much more effectively. Granted, we have over 330 million people and a decentralized system. But what is FEMA finding to be the biggest challenge with the vaccine rollout?
Well, I think there's a number of challenges. One, the supply of vaccine at the beginning of this is taking time to ramp up to meet the need. The president, since assuming office, has drastically increased the amount of vaccine. We're this week projecting over 14.5 million vaccine available to states, which is a 70% increase since January 20th. Then it's the next area is to focus on providing the resources to states and local governments to be able to vaccinate people. And the president has done a number of things to help that out. One, he's provided 100% funding through FEMA to states and local governments to help them with vaccinating. And that's been about $3.8 billion in 46 states, tribes, territories, and the District of Columbia provided. Number two, underneath his national strategy for the COVID-19 response and pandemic preparedness, he's also provided 100% funding to governors for their National Guard, which is critical because the National Guard is a tremendous capability to help with the vaccination effort. And then lastly, what he's done is provided federal resources to assist states and local governments. And we have thousands of federal vaccinators out there right now supporting states and local governments in their vaccination sites. In addition to that, we've established a pilot now where we have primarily federally supported state managed sites that are standing up throughout the United States to do mass vaccination.
That is certainly good news. Mr. Fenton, CBS News asked FEMA about reports out of San Francisco that the Department of Homeland Security logo on some vehicles in certain Latino communities is being covered up. Can you confirm that ICE and U.S. Customs and Border Protection are not conducting immigration enforcement operations at vaccine sites?
Yeah, they are not. DHS has put out a memo, and we've gone ahead and sent that out through many different methods that enforcement, that they will not conduct immigration and enforcement operations at or near vaccine sites, or for that matter, any healthcare facilities that are supporting people with COVID. So that is not happening. We are part of the Department of Homeland Security. We do rely on the whole of government, which includes entities like Coast Guard, and TSA and other agencies to help us in the vaccination. The critical thing is that what we want is everyone to sign up. What we're doing is reaching out through faith-based organizations, community-based organizations, to make sure that those that have social vulnerabilities have the ability to get vaccinated. That's really important and really an underlining priority of what we're doing with regard to President Biden's initiative.
All right. Well, Bob Fenton, acting FEMA administrator, thank you so much for joining us. We appreciate your time.
Thank you.
We want to turn now to Dr. Anthony Fauci, the chief medical advisor to President Biden, as well as the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome. So much to speak with you about and a lot of questions from our viewers. So let's get right to it. Dr. Fauci, there is concern about a new variant spreading in New York that some scientists worry may weaken the effectiveness of the vaccines. What can you tell us about how the vaccines already in circulation, as well as the Johnson & Johnson vaccine that may be approved soon, are responding to the variants, including this new one in New York?
Well, thus far, we've noted that the variants that have been gaining dominance in the United States, the one that was the first one that was of concern was the 117, which was the UK variant that clearly was dominant in the UK and then in the United States began to become dominant in the sense that if you do a model of it, it looks like by the end of March, that might be the dominant strain or variant, as we call it, in the United States. The good news about that, even though you always take these things very seriously, is that the vaccines that we have, when you look at the antibodies that they induce, really handle that particular variant very well. You don't like the idea of a variant that has a greater degree of capability of spreading, or that might actually have an increase in pathogenesis, which means it can give a more serious disease. But giving the vaccines that we have should handle them reasonably well. So it's kind of a bit of a race of the vaccine against the mutant, as well as making sure we keep up our public health measures. But other variants are emerging, such as the 526 from New York, which started off in a cluster of cases that was noted in the Washington Heights section of New York. But then over the next weeks or so, months, it was seen not only to be in Washington Heights, but also to be seen in other areas and other boroughs of the city. The degree to which this is able to be contained by the current vaccines or not is still being examined very carefully. We don't know exactly the effect or not of the vaccine there, but it is something we obviously always take seriously, have to keep in mind. And what we say, the best approach to the emergence of any variant is to prevent this virus from spreading. And you can do that by two ways, at least. One is by continuing to adhere to the public health measures that we continually talk about, the universal wearing of masks, physical distancing, avoiding congregate settings, as well as soon as the vaccine becomes available to you, please take the vaccine. Because although it might not be completely protective against a variant, the data that we have so far show that the vaccines that are in use at least prevent very well severe disease that leads to hospitalizations and death. So get vaccinated and continue to abide by the public health measures.
Important advice. All right, Dr. Fauci, let's get to some of our viewers' questions now. The first question comes from Liz T. Liz says, I am allergic to all preservatives, fruits, and vegetables. I also have an autoimmune disorder. I'm concerned if I take the vaccine, I will have a severe anaphylaxis reaction. Can you assure me this won't happen?
Well, I mean, whenever you deal with a situation with an intervention, as rare as it might be, you can never assure someone that they would not have an allergic reaction. People who have a propensity to an allergic reaction, particularly an anaphylactic reaction, have a greater likelihood of getting an allergic reaction to a vaccine. But if you look at the allergic reactions just recently reported in the scientific literature, there's about between 4 and 5 per million vaccinations with the Pfizer and between 2 and 3 per million vaccinations with the Moderna. If you do have a history of allergic reaction, so long as you don't know if it's an allergic reaction to something you definitely know is in the vaccine, you might want to wait for another vaccine. But if you just are an allergic person in general, to foods and other things, you can get vaccinated, but you should do it in a situation where you're in a location where someone can handle and treat an allergic reaction, rather than having it in a place where if you do get an allergic reaction, there was no way for it to be treated. But it is an unusual, if not rare, occurrence based on the numbers that I just told you.
All right, Dr. Fauci, here's a question from an actual healthcare worker. Haley T. is a vaccine administrator in New Jersey, and she says, patients often ask me whether they should be taking pain relievers either before or after the vaccine shot. I've heard mixed advice. What do you say?
Well, the mixed advice is based on the fact that there's very little data on that. I mean, if you're going to take something that suppresses an immunological response, then obviously you don't want to take something like that, except if you're taking it for an underlying disease. But if someone gets achy or gets a headache and it's really bothering you, I mean, I would believe as a physician that I would have
aging elders who are Black and brown. So really what we're seeing is we need to take the time to engage, to educate, and then those who are medically eligible will roll up their sleeves and get their shot. What we remind people here at Kedron is this is not Tuskegee. This is not Henrietta Lacks. This is not a medical experiment. This is an FDA advisory panel approved, emergency use authorized, essential medicine, this Moderna 19 vaccine, and this is our shot. This is your shot, and when it's your turn, we hope that we've engaged you, we've educated you, and that you'd roll up your sleeves and you'd take that shot.
Yeah, so perhaps the conversation really needs to shift from hesitancy to access. Mr. Urbowski, you know, we know there are a lot of roadblocks along the way in regards to both of these things. In fact, CBS spoke to a Baltimore pastor who had this to say. Let's listen.
I think it's an information problem, and I think it's a logistics problem. People don't understand. You don't have CVS stores and Giants and markets all over large sections of certain African American communities. They don't exist.
So what are some of the roadblocks that you were seeing, and what are the reasons you're hearing from people on why they aren't getting the vaccine?
Sure. I think Reverend Thomas there from Baltimore was very right that many people don't have the information. They don't know all of the facts. And as the physician just said, they need access both to the information and, quite frankly, to places where they can go and get the vaccine. I am very proud that my campus, University of Maryland, Baltimore County, produced Dr. Corbett. And she is that first Black woman to create a vaccine. And I can talk about that. When my wife and I participated in the study, in the Moderna study, we could say we believe in this vaccine because of Dr. Corbett, first of all, and we believe in science. But people need to see people like themselves involved in this process. Dr. Corbett is a perfect example. And on the other side, even at the Moderna side, we have graduates, Dr. Cash, African-American, who's helping in the manufacturing. So when people know that we have had people of color and African Americans involved in the entire process, it will give people even more trust and comfort in thinking, I must take this vaccine.
All right. Well, Jerry Abraham and Freeman Rabowski, thank you both for your insight. We appreciate it.
Thank you so much.
Montana Governor Greg Gianforte joins me now. His state is among the country's most efficient at getting people vaccinated in terms of percentage of distributed vaccines that have been administered. Governor, welcome. Great to have you with us. So what is your secret? I mean, granted, Montana has a small population compared to some of the larger states, but what are you doing differently than leaders in other states to get those shots into people's arms?
Well, Tanya, it's good to be with you this evening. And really, from day one, we've really prioritized getting shots in arms. And as you noted, Montana was announced yesterday. We're #1 in the country for getting vaccines in people's arms. We have a big state. And I really credit the Montana work ethic, the volunteers, our public health officials, and really our community leaders for, just as in the cowboy culture, we'd say, we're just getting it done.
And so your state is obviously more rural than some. What advice do you have for some of those other rural communities nationwide who might be feeling left out in the fight to vaccinate? And what can the federal government be doing to help?
Well, we just need more vaccines. I mean, we have 93% of the vaccines that we've received in people's arms. We've been sharing best practices, and this is one of the best efforts. We've literally had volunteers come out of the woodwork to help out, doctors coming out of retirement, nurses, community members helping out. That's really been the focus. And we were one of the first states in the country to prioritizing vaccines for people at risk of complications or death. This simplified our distribution and allowed us to get more shots in arms.
Now, you did recently remove Montana's state mask mandate. Of course, respectfully, Governor, people are still dying across the country and the virus is still very much alive. Do you think that's the best message to be sending, especially when the federal government is saying wear a mask even after you receive the vaccine?
Well, Montana's a big state, and one size does not fit all. Just to put it in perspective, we could fit Washington, D.C. in the southeast corner, Chicago in the northwest corner. We have counties that are bigger than the state of Rhode Island with about 1,000 people in them. It's important, but I think the core issue is that I trust Montanans with their health and that of their loved ones. They can make the right decisions for their family when they have good advice from us. And we've seen it show up in the numbers. Our hospitalizations are down, our new infections are down, and the number of vaccines going to arms is going up.
And Governor, when it comes to sort of the layout of your state, like you said, it is a vast state and the population is spread out. How did you manage to get people to convene at vaccination sites? Or did you have, volunteers and healthcare workers going out to find people who, might be a little off the grid, so to speak?
Well, it's been a combination. Really, we've worked with our pharmacy partners to get all our nursing homes and long-term care facilities vaccinated. That was critically important. We relied on our hospitals and community health centers, critical access hospitals, to get our frontline healthcare workers vaccinated. And then we made the distribution really simple by saying, we're going to focus on folks that are 70 years of age and older, or people with underlying health conditions. So those were instructions everybody could understand, and it made it a lot easier to get vaccinations in people's arms.
All right. Well, whatever you're doing, it's working. Montana Governor Greg Gianforte, thank you so much for taking the time to speak with us. We appreciate it.
Thank you so much, Tanya.
The fight to get kids back to school. When we come back, parents, teachers, and lawmakers have different ideas about when and how students should return to class full time. Miami's school superintendent weighs in on how the vaccine could help. Plus, a jab or a job. We look at whether employers can actually force workers to get the shot. And Dr. Anthony Fauci will be back to answer more of your questions. A Shot of Hope returns after a quick break. You're streaming CBSN Always On.
The biggest names in politics.
Whoa, that's news. Do you think that the president has the authority to send in active duty troops?
Face the questions you want answered.
Did the CDC let the American people down? Tell me about the decision. When was it made? Who made it?
What is the next area that you are concerned about?
What does that mean for the risk of reinfection here in the United States?
You bring up a very good point, Margaret.
Margaret, that's a great question.
Face the Nation with Margaret Brennan on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.
Boom.
And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more.
Experience thought-provoking.
Welcome to the idea of being a human being.
Innovative and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
Hello, everyone. I'm Tanya Rivero. Welcome back to CBSN's A Shot of Hope, Vaccine Questions Answered. Schools nationwide now have guidance for reopening safely. It is the first science-based national strategy, according to the CDC. But some critics say those guidelines do very little to actually help schools reopen. The CDC is recommending a color-coded system based on community spread of coronavirus. Schools in areas with lower transmission rates are blue and yellow zones where in-person learning is recommended. Red zones are high transmission areas with the most restrictions. Elementary schools can remain open, while middle and high schools are recommended to go hybrid or virtual only. Around 72% of schools currently fall into this category. Meg Oliver has more on the challenges many students and families continue to face.
Tanya, across the country, millions of students are still attending school only remotely, like here in Montclair, New Jersey, where the district has sued the teachers union for refusing to return in person. Another example is in Los Angeles. Next week, the teachers union there will vote to return in person. One of their demands includes vaccinating all staff first who want it.
It's frustrating. So frustrating. It's frustrating because trying to hold it together.
Renee Bailey has 2 children in the Los Angeles Unified School District, a kindergartner and an 8th grader with an intellectual disability. She desperately wants them back in the classroom.
Tell me how this has taken a toll on your son with the intellectual disability.
Intellectually, he's about a 3 or 4-year-old. So his attention span is roughly 2 to 3 minutes. So throughout the day, you're watching my son sitting there and punching himself in the face because he's so frustrated. And you'll just see the red marks, or if it's been a really bad day, you can see the blue marks on his arm from biting his skin.
Kids are suffering. Open schools now.
Parents in Los Angeles started protesting this week after the union refused to return, even after federal and local health officials said elementary schools could reopen.
All staff are either fully vaccinated or provided access to full vaccination.
Do you think vaccinating all of the teachers will help you reopen faster?
I would hope that it would help reopen the schools faster. But unfortunately, out here in Los Angeles, we've been dealing with a situation with the unions where it seems like every time we're to the brink of opening, there's another obstacle or a demand being thrown out there that pushes the date further and further.
For many children, as the pandemic has raged on, their mental health has continued to suffer. The CDC says between April and October, emergency departments saw a more than 30% spike in visits from children 12 to 17 years old for mental health reasons.
Do you feel the kids that are learning virtually, their mental health is declining?
100%.
Sherry Glassman is a school psychologist in Little Falls, New Jersey, where there's a hybrid program. Some students in person and others are virtual.
Virtual students are dealing with a lot of isolation, a lot of, screen burnout.
How many calls do you receive a day from parents worried about their children?
At least 5 to 10 calls a day, and it's all about mental health issues.
Dr. Maria Yarovi is a pediatrician in New Jersey. She said the calls she gets are about kids as young as kindergarten through college.
What are the biggest signs you should look for if you think your child is really struggling?
Not wanting to be involved in activities, not wanting to eat, just staying in their room, sleeping, not wanting to do anything.
In a September survey, more than half of children ages 11 to 17 reported they had thoughts of suicide or self-harm nearly half or every day in the previous 2 weeks. They were also more likely than any other age group to have moderate to severe symptoms of anxiety and depression. For families like the Baileys, they're not sure how much longer they can wait for schools to reopen.
How much longer can you hold on?
It's a day-by-day situation. It might sound extreme, but I love my house in Los Angeles. But I've already started considering moving to other areas that have taken the approach of reopening the schools, because this is a game that I don't want to play with my kids.
In addition to vaccinating teachers in LA, the union also wants a comprehensive safety plan, including PPE, ventilation, social distancing, and a cleaning regimen. Tanya?
Meg Oliver, thank you. For more, let's bring in Alberto Carvalho. He is the superintendent of the Miami-Dade County Public Schools in Florida, the nation's fourth largest school system. Superintendent, welcome.
Thank you very much for the opportunity, Tanya.
So you and your team in Miami-Dade were at the forefront of reopening schools during the pandemic. How has it been going for you so far, and what has been your model? Fully open or a hybrid?
We have been fully opened since October 5th. That means over 400 schools across the fourth largest school system in America, providing parents an option to send your children to school all day long or keeping them home and taking advantage of our virtual educational program, distance learning. And our community has been pretty divided. 50% of our students have returned to the schoolhouse. 50% of the parents have opted for a whole host of reasons based on workplace convenience, underlying conditions of the parents, students, or family members. But those parents opted to keep their children at home. Our experience has been reasonably successful. We've had good systems in place, guaranteeing transparency tools for the parents, contact tracing, vaccination of our 65 and older teachers. Now we're going to start vaccinating our 50 and older teachers, but around the clock, testing of both teachers and students in school site locations at no cost to anyone. In addition to obviously very airtight protocols and mitigation strategies, they are common to everybody across America, such as social distancing in schools, mandatory wearing of masks, electrostatic disinfection of buildings, single direction hallways and stairways, mandatory wash cycles of hands for students. If you have all these elements together, then you can, even in communities with a relatively high positivity rate, continue to have schools open for the benefit of students.
And Superintendent, the White House has reiterated that teacher vaccinations are not a prerequisite for reopening schools nationwide. Do you believe they should be?
So I don't think that vaccination is necessarily a prerequisite for students returning to schools for the reopening of schools, because we are prima facie example that schools can safely operate without people being vaccinated. We've been open since October 5th. However, with that said, look, teachers, school site personnel who have direct contact with students and the community are essential frontline, indispensable workers. So they should absolutely be prioritized for the coronavirus vaccine. I don't see why not. You have obviously health professionals being prioritized. You have individuals who live in nursing homes being prioritized because they are at special risk. I think those individuals who have functions are indispensable to our society, to our economy, who are frontline workers, should be prioritized next. The governor of the state of Florida has now prioritized teachers ages 50 and higher as part of next wave of vaccination. I believe we need to prioritize every single teacher, in addition to every single school site and direct contact personnel in schools, if we are to maintain schools as viably open for our students and their families.
And there is obviously a big debate over how to reopen schools safely, and each state is, of course, facing its own obstacles. What type of national policy would you implement if you were at liberty to do so, and would vaccines be at the center of it?
So I think the national policy that needs to be in place, number one, let's not forget the federal government has an important role in appropriating the necessary financial resources to states and local school systems for us to have the necessary PPEs, the necessary cleaning equipment, the necessary cleaning supplies for the long haul. Secondly, we need to liberalize a little bit, E-rate prerequisites for the expenditures associated with technology. We have learned during this pandemic how important digital connectivity, devices, and connectivity are for students and teachers alike. So there's a great deal of work that needs to be done in that regard. Next, I believe that in as much as the new CDC guidelines take us one step further in clarifying the appropriate conditions for return to school. I think those need to be considered on the basis of conditions at local levels. And I think the federal government has done a good job in this last rewrite of recommendations in understanding the regional variance of positivity and how systems can react to that. Ultimately, as you suggested, I do think that prioritization as far as teachers and school site personnel and direct contact personnel, that means the bus driver who picks up the child at home, the custodial staff, the cafeteria staff, teachers and paraprofessionals must be prioritized in terms of access to the vaccine if we are to ensure long-term continuity of learning in school as parents and students expect.
All right, well, Alberto Carvalho, Superintendent of the Miami-Dade County Public School System, thanks for your time.
Thank you very much.
It's not just kids who have suffered from working remotely during the pandemic. Many adults also wonder when they will go back into the office. Some companies want that to happen soon. In fact, a number of well-known brands are incentivizing employees to get vaccinated, some of them even offering cold, hard cash, including McDonald's, Target, Amtrak, and Dollar Tree, among others. For more, I'm joined by Erica Pandy. She's a business reporter with Axios. Hi, Erica. Great to see you. So first off, we know universities across the country require incoming students to be up to date on a host of immunizations. Once vaccines are readily available, can employers require employees to get vaccinated for COVID-19?
So the short answer is yes. The EEOC has issued guidelines that say employers can do so, and you've seen like hospitals and schools do that have done this for a very long time. There are some exceptions. For example, if you have a medical issue or disability or sincerely held religious belief, you can, hold off. But the short answer, yes, employers can legally require their employees to get vaccinated.
And so if getting a vaccine becomes a condition for employment, what might this mean for those who would try and get a waiver? Could this open the gates for vaccination discrimination lawsuits?
Yeah, you've already seen this play out, right? There is a young woman in New York City who got fired from a restaurant she works at because she's not even against vaccines, but she wanted to just see if it affects fertility and pregnancy, which is, being studied right now before she goes ahead and gets it, and her employer fired her. So you could see people like this come back with lawsuits. The pandemic has already really caused workplace lawsuits to spike because people either don't feel safe going to work or they feel like their employer is taking away their freedom, making them get a vaccine. This is just going to add to that.
All right. The future is now. Erica Pandy, thank you so much for joining us. We appreciate it.
Thanks for having me.
Still to come, from teens and vaccines to when everyone will be able to get a shot. Dr. Anthony Fauci is back to answer more questions from our viewers. This is a CBSN special, A Shot of Hope. We're back in a moment.
The biggest names in politics.
Whoa, that's news. Do you think that the president has the authority to send in active duty troops?
Face the questions you want answered.
Did the CDC let the American people down?
Tell me about the decision. When was it made? Who made it?
What is the next area that you are concerned about?
What does that mean for the risk of reinfection here in the United States?
You bring up a very good point, Margaret.
Margaret, that's a great question.
Face the Nation with Margaret Brennan on CBS.
Go to the ends of the earth.
Right now.
We got something crazy.
Boom. And reach for the stars.
Here we are.
Time.
Yes, it's my comeback.
Hey, this is pretty fun.
But wait, there's more.
Experience thought-provoking.
I'm open to the idea of being a human being.
Innovative and truly original reporting.
Look through a telescope and go, wow.
Because there's always something new under the sun on CBS Sunday morning.
Welcome back to CBSN's A Shot of Hope, Vaccine Questions Answered. We've still got a good amount to get to. Let's bring back Dr. Anthony Fauci, Chief Medical Advisor to President Biden, as well as Director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, thank you so much for staying with us. Doctor, I want to ask you about something you originally said about vaccines, that it would be, quote, open season by April, but you pushed that estimate back by about a month or two. What does open season actually mean? And do you worry it could create a situation where people flood vaccination sites and millions of disadvantaged people still find themselves struggling to get a shot?
Okay, let me explain what I meant first by what I said when I said open season. So when you have a situation where you don't have enough vaccine to give to everybody all at once, and you have to prioritize, you note that there are prioritizations that have come out on the basis of the Advisory Committee on Immunization Practices, which advises the CDC, who have the ultimate responsibility for making recommendations of when vaccines should be given to certain groups of people. So the 1A, so it goes to 1A, 1B, 1C, and then 2. To me, 2 would be open season. Namely, you're not among the priority ones. So right now, the first groups of vaccines that came out would have gone to healthcare providers and people in nursing homes and extended care facilities. Then the next group had people beyond a certain age, as well as what are considered essential members of society, people who are important to make our society run. Then you go to the next group of people who are like 16 to 64, who have underlying conditions, and then others that are in essential jobs, but not as essential by judgment of some of the others. Those are the priorities. Once you get beyond them, then there are no people who have priorities. I call that open season, meaning anybody, normal 25, 30-year-old person, has no underlying conditions, is not in a high priority position in society, they can go up to wherever they're being distributed, be they community vaccine centers, whether they're pharmacies, whether they're mobile units. At that point, I originally had said April, but because of the fact that there was more of a gap between the supply and demand than we had anticipated by the end of April, I had pushed that to maybe May or early June, very likely the end of May, the beginning of June, when we will have many, many more doses of vaccines that you could actually give to people. Addressing the second part of your question, we're very sensitive to the fact that we want equity in the distribution of vaccines, particularly equity to our minority populations. And as I mentioned just a moment ago, that's the reasons why one of the first things that President Biden did was to get the federal government to be putting up together and in collaboration with the locals, doing the community vaccine centers and putting them in locations that are representative of minority groups. Also the same with pharmacies. Importantly, mobile units. And then finally, something that is really critical. He's established a equities task force that is chaired by an African-American physician, Dr. Marcella Nunez Smith, whose complete job is to address the issue that you're alluding to make sure that there is equity in the distribution, particularly among underserved people, generally in the minority groups.
Right. All right. So we want to get to more questions from our viewers, Dr. Fauci. This next one comes from Michelle O. And she asks, with the mRNA vaccines, how long will the genetic coding be active in the body, and does it stay as a genetic marker? Can that genetic coding be passed on in utero? Well, first of all, that's an excellent question. People ask it all the time. It really decays. The RNA will code for the protein, but after a period of a day or two, likely it will just decay and be gone. The issue of it should not, in essence, go in utero. We had many pregnant women now who are not in the clinical trials, but who actually have received the vaccine while they were pregnant because they elected to. Many of them were healthcare providers who felt that the risk of COVID-19 disease on their fetus, their unborn fetus, is much, much greater than any hypothetical risk from the vaccine. And thus far,
with thousands of women who were pregnant having gotten the vaccine following the EUA. There have been no red flags of anything that anyone would be worried about. But obviously what we're going to be doing anyway, and we've already started that, is doing actual studies, clinical trials in pregnant women to determine the answer to just the questions that this caller had asked. A, is it safe for the mother? And B, is there any issue with the baby? Thus far, we haven't seen it in the observational studies, but you want to do a specific study to answer that question.
And there is a good follow-up question to that question, Dr. Fauci, that this particular one is from Rima P., but we've heard it from several women. Does the vaccine affect fertility in women and teenage girls?
There is no biological reason at all, any mechanistic reason that you could imagine that it would affect fertility in women and teenage girls. Remember, right now, we are in a situation, this vaccine has only been out literally for a year or less than a year. But when you ask a question like that, you have to ask yourself, what would be the biological reason why that would occur? And there really is no biological reason. There will obviously be long-term follow-ups and studies, but this is not at all something that you would anticipate.
So it's not something you have a concern about, because it's interesting. We did hear that question from multiple women.
Well, you know, I think when you get a question that is asked by many women, that's not necessarily proportion to what the actual risk is. They are reasonable questions that women will ask, and they should be asking those questions. So there's nothing wrong with asking that question, but you don't want to interpret that when many, many people ask the question, that is evidence that it actually happens.
Right. So, Dr. Fauci, our next question is from Jeanette K., and she asks, when will a vaccine be available for children under 16, and what's being done to help children who have disabilities that make contracting the virus potentially deadly?
Well, first of all, the vaccine will be available for children under 16 by a couple of the studies that are ongoing now of looking at between 12 and 16. So let's talk about the high school group, which is 12, 13 through 16 to 18, and then people who are in elementary school, namely 12 down to 9, 9 to 6, 6 to 2 years, 2 years to 6 months. A couple of the companies, Pfizer, Moderna, and others, already are doing studies or observations that will make it likely that high school children will be able to get vaccinated sometime the fall of this year, 2021. That is a situation that may not be the first day of the fall term, but it almost certainly will be available in the fall term. Because of the concern about safety of new vaccines for children, particularly the vulnerable, children are vulnerable, that there will be what's called age de-escalation studies that have either started or will start very soon. By age de-escalation, you mean you start off with a certain age and you say, let's look at kids from 12 to 9, we're okay. Let's go then from 9 to 6, we're okay. Let's go from 6 to 2. Let's go from 6 months to 2 years. Those studies almost certainly will not be completed until the first quarter of 2022. So bottom line, big picture, is that high school kids will likely have availability by the fall of this year, but it is anticipated that you won't have the younger elementary school and below children getting vaccine until at least the first quarter of 2022. And I'm sorry, the second part of the question you were saying.
I'm curious whether we can achieve herd immunity before the vaccination of children.
The answer is we've got to make sure that we separate the classic definition of herd immunity, which when you have enough people in the population that are vaccinated, that you have kind of an umbrella of protection over the whole society because the level of virus gets so low that it makes it difficult for the virus to find a vulnerable group of individuals. We don't know right now what the precise percentage of herd immunity is, and herd immunity would really be a combination of vaccine-induced protection and those who've been infected and are very likely protected against the same strain of virus that infected them to begin with. We can make an estimate that this is, let's say I have made an estimate, and I have to be modest and humble about it. It is an estimate that I think is a reasonable estimate, and that is between 70 and 85% of the population. We don't know that of what the exact number is until you've reached it, you have herd immunity, and then when you drop below it, you start to see cases cropping up. However, what we want to make sure people don't get into the mindset that say it's either herd immunity or nothing. Because if you get 20, 30, 40, 50, 60% of the population vaccinated, you're going to see a very profound effect on a diminution of cases, diminution of hospitalizations, and diminutions in deaths. That's exactly what's going on right now in Israel, which, because of the nature of the country, the small size, the population, they've reached a certain percentage of the population that is vaccinated. They may not have yet reached the classic definition of herd immunity, but the number of cases that have gone down, the hospitalizations, are very extreme in the sense of, in the good sense. So although we want to establish herd immunity, remember, we don't know exactly what that number is. You can get an enormous benefit for every increment of a percent of the people that are vaccinated. And that's what we're doing now. And that's the reason why, with the increase in vaccines that will be available in the month of March and April and May, the more we can get people vaccinated, the more protection we'll have. And importantly, the more we will avert the evolution of these variants, because the more you suppress the virus, the less you give it a chance to evolve into a new variant.
Such good advice and something we can all look forward to. Dr. Fauci, you've been so generous with your time. Thank you so very much for joining us. I think it goes without saying you've been a consummate professional during this entire pandemic, providing guidance for so many people. Thank you so much. Stay safe and good luck going forward.
Thank you, Tanya. Very good to be with you. Thanks a lot.
For continued information about the vaccines and the latest on COVID-19, you can log on to our website, cbsnews.com. We hope we've answered many of your questions. I'm Tanya Rivero. This has been a CBSN special, A Shot of Hope, Vaccine Questions Answered. Thank you for joining us.
The biggest names in politics.
Whoa, that's news. Do you think that the president has the authority to send in active duty troops?
Face the questions you want answered.
Did the CDC let the American people down? Tell me about the decision. When was it made? Who made it? What is the next area that you are concerned about? What does that mean for the risk of reinfection here in the United States?
You bring up a very good point, Margaret.
Margaret, that's a great question.
Face the